With this technique, we use PET-MRI to identify physiologic biomarkers of bone turnover. We believe these physiologic biomarkers may more accurately reflect facet joint pathology than CT and MRI static images. We believe this technique may help us identify painful and symptomatic joints in the lumbar spine. We also hope that this technique can be applied to other regions of the spine, such as the cervical and thoracic spine, for identification of symptomatic facet joints and even degenerative disc disease.
For simultaneous PET and magnetic resonance image or MRI acquisition, using a posterior array central molecular imaging array coil and a 3.0 PET and MR imager, center the field of view in both imaging modalities to cover the lower spine region from T12 to S3. Set the appropriate parameters for a PET acquisition and for a clinical MRI sequence for a lumbar spine protocol. Immediately before acquiring the MRI sequences, intravenously inject a 0.1 mm per kilogram of gadobutyl contrast into the patient's antecubital fossa and a 2.96 megabecquerel per kilogram radioactive dose of sodium fluoride F18. Next, using 3 separate temporal phases centered over the lower spine, perform a 60-minute dynamic PET scan, acquiring the first phase of the scan with 12 frames of 10 seconds each, the second phase of 4 frames of 30 seconds each, and the last phase of 14 frames of 4 minutes each. Then set a 60 cm field of view with a 3 mm filter cutoff, a standard Z-axis filter, no cardiac 3D filter, 28 subsets, and a time of flight ordered subsets expectation maximization with